So this is a kind of a terrifying story, I'm going to be honest. And like I'm not even being hyperbolic here. This shit is terrifying. Like anyways, I'm not going to bury the lead here. So Trump administration is launching a new private health tracking system with big tech's help. Okay? Like for starters, how many databases are there now? How many, like, we've been covering this, like he is putting together so many different types of databases on Americans and people here. It's getting a little bit concerning. So of course you have the Palantir or Palantir, excuse me. I always want to say Palantir. I think it's Palantir. That database with Peter Thiel, and you have the autism database from RFK Jr. You have using databases like ICE using databases from ultra Zionist, like just horrid groups, called the Canary Mission, that like docks Palestinian and like pro-Palestinian students. It's crazy. We covered a story just a few weeks ago how the Trump administration requested voting records from, I think, like 9 states. Why? What's that information going to be used for? The data that they're forcing universities to hand over, like they're going to a bunch of elite institutions and demanding that they turn over their files, like all student records on foreign students. And then we're going to be, after this video, be on the lookout for it. We're going to be covering how they're now forcing universities to hand over I-9s of all of their employees to the Department of Homeland Security. And there's probably at least like 3 or 4 other database type things they're doing that I missed. Like, there's a pattern here, and it's a little scary. All right, I'm just going to be honest with you. Anyways, from the AP. Trump administration is launching a new private health tracking system with big tech's help. The Trump administration announced it is launching a new program that will allow Americans to share personal health data and medical records across health systems and apps run by private tech companies, promising that will make it easier to access health records and monitor wellness. More than 60 companies, including major tech companies like Google, Amazon, Apple, as well as healthcare giants like United Health Group. Bro, you just named like the 4 evilest companies, like the top 4 villains in our country. Jesus Christ. In CVS Health, aren't they like going out of business or something? Am I wrong on that? Anyways, have agreed to share patient data in the system. They've agreed to share patient data in the system. The initiative will focus on diabetes and weight management, controversial artificial intelligence that helps patients, and digital tools such as QR codes and apps that register patients for check-ins or track medications. For decades, America's healthcare networks have been overdue for a high-tech upgrade. President Donald Trump said during an event with company CEOs at the White House on Wednesday, the existing systems are often slow, costly, and incompatible with one another. But with today's announcement, we take a major step to bring healthcare into the digital age. You see, in like a utopia type situation, like in my ideal world, if it was perfect, we're talking utopia here, I would be completely down for a system like this, almost like a centralization of all of our healthcare records, because I'm sure many of you have like changed providers and gone to one network to another, and you have to go through this process of like transferring all your records, and it's just a headache, man, and it can take months sometimes, and that can really delay your care. But let's look at the people who are doing this. We're talking about some of the evilest people you can name that are behind this. And like, is this going to be an opt-in type of thing, or is this going to be like you're automatically enrolled and you have to opt out? Can we opt out? Like, I have so many questions here. This sounds terrifying. Remember, United Health Group, Google, Amazon, some of the evilest companies we have. Some of the companies that, obviously United Health Group, you don't need to, that's self-explanatory, but like Amazon, the number one company for treating their workers like fucking animals. And same with like Google and Apple. These are companies that'll cut like dozens of thousands of words are hard. Dozens of thousands of employees just like to replace them with AI or just without second thought. Like these are scary companies that also sell your data to anyone and everyone. Like, God. Okay. So no. God, no. Like I said, utopia situation and under like actual very, very independent and like well-meaning guidance. Yes, this is awesome. I agree. We do need some form of reform here, but not with like the top most evil private corporations. I'm sorry. The system spearheaded by an administration that has already freely shared highly personal data about Americans in ways that have tested legal bounds could put patients' desires for more convenience at the doctor's office on a collision course with their expectations that their medical information be kept private. There are enormous ethical and legal concerns, said Lawrence Gossin, a Georgetown University law professor who specializes in public health. Patient patients, across America should be very worried that their medical records are going to be used in ways that harm them and their families. Officials at the Centers for Medicare and Medicaid Services, who will be in charge of maintaining the system, that's RFK Jr., by the way, Dr. Oz, by the way. Can you see why I'm like freaked out about this? Like, have said patients will need to opt in for the sharing of their medical records and data, which will be kept secure. Okay, thank God. That alleviates some of my worry. That alleviates some of it. Opt in. All right. All right. That's better. That's better. But I still am terrified of these people having any of this data. And I feel like a lot of people are going to unknowingly opt into this stuff. And, you know, they're, you know, in these apps, they're going to have some sneaky ways that kind of automatically opt you in without you realizing, like with all these terms and all this. Yeah, check this, check this, check this, check this. You know what I'm saying? Like they're good at burying that. So that's a concern. But I am glad that at least at face value, it is opt in. Those officials said patients will benefit from a system that allow them to quickly call up their own records without the hallmark difficulties, such as requiring the use of fax machines to share documents that have prevented them from doing so much in the past. I agree. We're going to have remarkable advances in how consumers can use their own records. Dr. Oz, oh God, oh God, oh God, oh God, oh God. He's a literal snake oil salesman. Like, popular weight loss and fitness subscription service Noom, which has signed onto the initiative, will be able to pull medical records after the system's expected launch early next year. That might include labs or medical tests that the app could use to develop an AI-driven analysis of what might help users lose weight. CEO Geoff, I don't fucking know, Cook told the Associated Press apps and health systems will also have access to their competitors' information too. Noom would be able to access a person's data from Apple Health, for example. Right now, you have a lot of siloed data, Cook said. Patients who travel across the country for treatment at the Cleveland Clinic often have a hard time obtaining all their medical records from various providers, said the hospital system's CEO, Dr. something. He said the new system would eliminate that barrier, which sometimes delays treatment or prevents doctors from making an accurate diagnosis because they do not have a full view of a patient's medical history. Do I think this idea and the issues that they're pointing out are valid? Absolutely. Which is, don't be fooled. A reason why Donald Trump has been elected 2 times is because he was good at calling out valid issues that exist within our country. Now, the problem is his solutions to these issues are just not solutions. In fact, most of the time it makes things worse. You can see where I'm going with this. So, like, the solution to having, all of this medical data siloed and just, like, they are absolutely right. It is such a pain in the ass to change providers, change doctors. Like, it can take months. And yes, your treatment could be delayed because of it. That is so goddamn correct. I'm not even going to pretend it's not correct. But the fact, like, this shouldn't be carried out by private corporations, especially some of the most infamous private corporations. If we're gonna like move towards centralizing our healthcare system, which I absolutely support, like all of this medical, like all of this should be centralized. I know that might be a hot topic, but like something has to change there. It is a pain, and anyone who's gone through it knows how much of a pain it is. But like this needs to be done by, I'm gonna say a scary word, but by the government. Okay, not private, not private corporations. This is just leading to so much potential disaster. And it's gonna be funny how like MAGA is gonna be so on board with this, trusting these CEOs, which are again some of the worst, with all this information, but won't trust the 99% of actual qualified educated experts that vaccines are safe. But like, I mean, these are the same people who scream about Bill Gates wanting to use the vaccine to like microchip you or put a chip in your brain or whatever, while simultaneously defending the person who actually wants to put chips in your brain. Like, there's no logic with these people. But yeah, this is again the problems that they're pointing out are absolutely valid, but the solution I'm not very comfortable with, because these are not like well-meaning people at all, like at all. Anyways, like and again, uh, back to MAGA question: if there was a Democrat leading this effort, like Joe Biden, would you have the same stance? Would you be as okay with this? All right, I digress. This is just it's a complicated subject to be okay, because I support the issues they're calling out. I just don't support the solution. Let me know what you think in the comment section down below, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below, and if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.